This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
Welcome to the human side of healthcare. Delighted you're with us today. And today we're going to be talking about maternal mortality, infant health, and infant mortality. We have with us Dr. Aiyanna Anderson, who is chair of the Department of Obstetrics and Gynecology at Texas Health Harris Methodist Hospital in Fort Worth. Dr. Anderson, welcome to the show.
Oh, thank you for having me. It's a pleasure to be here.
You know, many of our listeners may not understand maternal mortality. Can you set the stage and define what is maternal mortality?
Okay, so that is a very good question. When we look at maternal mortality rates, we're looking at the number of deaths per 100,000 live births within a year. So that's from the time the mother delivers up until a year. If she passes within that time frame, that counts as a maternal mortality.
So it is a 12-month time frame. I think a lot of people get confused and don't realize that and say a year is a pretty long time. What are some of the complications that you see within that year that could cause death?
Well, some of the complications may stem from just some baseline medical issues the mother may have had prior to becoming pregnant, which is why it's so important to have those conditions controlled prior to achieving pregnancy. But so they can be the result of heart disease or high blood pressure or asthma or being overweight or obesity. Some people are immunocompromised, and some things can be related to mental health issues as well.
Like postpartum depression could lead to suicide. Does that often happen?
Yes, that would count as a maternal mortality, yes.
So let's talk a little bit about infant mortality. Can you describe to our listeners how prevalent that is, say in Texas?
Yes, that also, like maternal mortality, we're looking at the denominator of that would be among 1,000 live births. So we have a rate of infant mortality, and that is out of 1,000 live births. So the most recent data that we have for Texas is from 2020, and the infant mortality rate is about 5.29 right now, which is pretty significant because Texas being one of the larger states, that attributes to almost 2,000 deaths for 2020 of infants.
Yeah, that is a terrible statistic. You may not have this information, but that was Texas. Is North Texas mirror kind of the state of Texas, or would you say we are higher or lower?
So that is Texas overall. I do have some information about Tarrant County and Dallas County specifically. So both are slightly higher. For Tarrant County, the latest numbers we have are 2019, and that rate is 5.5 per 1,000 live births for the infant mortality. And that, again, that sounds high, but that actually is a 20% decrease from 2010, and it's below the healthy people 2020 goal of being less than 6 per 1,000 live births. Dallas is a little higher. Dallas County in 2019 was 6.16 per 1,000 live births.
You know, when you look at that data, and I don't know how detailed it is it generally within North Texas, or can you dig deeper and say it's in certain areas or even by zip code? Do you know if there are certain areas that tend to run higher than others?
Yes, unfortunately, we think of child bearing and pregnancy being a happy time, but depending on where you live in the country, where you live in your particular state, and even in your zip code, that could determine if your rates are higher. Between 2011 and 2014, if you lived in the zip code of 76104 in Tarrant County, the rate was actually more than 19 infant deaths per 1,000 live births. So that's, atrocious. So it really does depend on where you live.
So that was in Tarrant County. That is amazing.
Yes, that's amazing. And the patients, they know this. The patients I see, some of them, one of them, actually, she probably was quoting that when she told me, I'm afraid to have a baby. This is the worst place to have a baby in Texas. So
that is amazing. Now I'm going to ask a little bit more about maternal mortality. I read a statistic the other day that said roughly 11% of live births in Texas were to African American women, and yet the mortality rate, maternal mortality rate for African American women was 31%. Have you seen statistics like that?
yes, unfortunately, being a Black woman is very personally to me, those statistics. And they're across the country as well. The recent data from the CDC that came out last month talked about that Black women are 3 times more likely to die during or after pregnancy than white women. So, and those numbers increased, or risk increased during the first year of the pandemic. You saw a spike with Black and Hispanic women, and the overall mortality was going up. But of course, within Hispanics, it went up 44%, and Blacks 25% compared to white women at 6%. So I'm not shocked about those numbers, unfortunately. But it is a crisis and something we have to work on.
I also read where Texas is above the national average in maternal mortality. Have you seen that statistic?
Yes. The most recent data that we have for the U.S. is from 2020, and the maternal mortality rate, again, that's per 100,000 live births, was 23.8. And just this year for 2022, Texas is at 34.5. So we are higher. Again, a lot of things break down to region of the country versus the state, and actually, as we mentioned earlier, zip codes in the state.
So I guess from a healthcare policy point of view, we, the community, should urge our legislators, especially in Medicaid, to extend the maternal mortality coverage to 1 year after birth. Would you agree with that?
Yes, I am so glad you mentioned that. That was one of the things I was going to talk about as a community that we should be advocating for. I talked about these medical conditions that could lead to mortality, beyond 6 weeks and beyond up until a year. And so if we had comprehensive coverage for the mother and the baby during that year, we could have healthier moms, healthier babies, and maybe prevent some of this mortality.
We're talking with Dr. Aiyanna Anderson. She is the chair of the Department of OB/GYN at Texas Health Harris Methodist Hospital in Fort Worth. It is a new year, and it is a legislative year, and Steve Love is going to be very involved in Austin this coming year, and hopefully they tackle some of these issues that they are discussing here. And another big issue we're going to tackle next is teen vaping on the human side of healthcare.
This is the human side of healthcare, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
Welcome to the human side of healthcare. We're delighted you're with us today. And today we want to talk about teen vaping and how it impacts the lungs of teenagers. We're delighted to have with us today Dr. Andrew Miller, who's a pulmonologist at Texas Health Harris Methodist Hospital in Fort Worth. Dr. Miller, welcome to the show.
Well, thank you for having me. It's an important topic, and I'm excited to be able to share some information.
To set the stage, let's talk numbers. Can you describe or estimate how many teenagers in the U.S. admit that they're using e-cigarettes?
It's not extremely well known because teenagers, as you might expect, aren't always the most open and honest, but CDC data tends to suggest somewhere around 2 million teenagers in the United States are using e-cigarettes.
And it's my understanding that most of these vaping products do have nicotine, which we already know is addictive.
Absolutely. So nicotine is profoundly addictive. If you look at older studies of mice, and they'll be fed food, water, and a choice of nicotine, or food, water, and a choice of drugs like cocaine or even heroin, they'll actually select the nicotine over some of those other types of illicit drugs. It's profoundly addictive. And so what's known about many of these e-cigarette type products and vaping type products, that not only do they contain nicotine, but the levels of nicotine are many, many times higher than most cigarettes. And we're talking on the order of 100 or more times higher. So people may think that they take a small puff of a vape pen and think they're only getting a small amount of exposure, but indeed a small puff may be the equivalent of 10 or 20 puffs of a cigarette. So it's not only do they have nicotine, but the amount and the concentration per puff is significantly higher in many cases.
And you mentioned in your answer about a vaping pen. I've looked at some of these products. Some of them look like USB drives, markers, pens, as you said. The marketing to young people is unbelievable.
Sure. I mean, I think they know what their target audience is, and they go after it. I mean, if you look back in the 1950s and 60s, it was candy cigarettes, and nowadays it's, as you say, USB drives or laser pointers or pens or everyday items that allows the teenagers to perhaps hide them in school in a backpack from their parents. And some of these products are actually dual use. What looks like a pen may be a pen as well as a vape pen. They can be taking notes in class and almost vaping at the same time, if you will. Same with the USB drives and some of the others, where they look like objects, but they actually might have dual use.
How do the vapors affect the lungs?
It's a great question. And I think to start off, I should say there's a belief that has been demonstrated and proven false, but a belief that vapors are somehow safer or safe at all, and that smoking a cigarette isn't. Without getting too technical, a vapor from a scientific or chemical standpoint is the gaseous form of, say, a liquid, but it's a pure gas. Smoke is something that is a gas but has small or fine particles in it. And anyone who's been near a forest fire or a campfire kind of knows that. They get on you. You can almost feel them. And so when you combust a cigarette, that causes smoke, which when inhaled, you now have this gas, but also these fine particles that make their way down into the very base of the lungs, which you call the alveoli or the air sacs. Vapors, which people think, well, it's not smoke, there's no particulate matter, what's sometimes called tar, with cigarettes in them, it was presumed to be somehow safer, but the actual chemicals that make up the vapor are by no means safe, nor are they healthy for the lung. And unfortunately, as again, anyone knows who's ever breathed in any vapor, whether that was from, if you walk into a salon, or any other location and take a deep breath, you immediately feel a tightness and perhaps even start coughing. And those are vapors. And so at the end of the day, the lungs are designed to have clean air in them, not other chemicals, not particulate matter. And so any of those chemicals that get into the lung, you can feel the reaction, and it has been well proven and shown to cause significant damage to the lungs.
How would you say vaping impacts lung function and lung capacity?
That's a very good question. And again, I don't want to be too technical, but when the lungs are exposed to something other than clean air, could be you took a sip of coffee and went down the wrong pipe, as they say, could be certainly smoking, vaping, could be exposure to a fire, etc. But at any time you have a chronic or ongoing exposure to the lung to something other than clean air, the response to that in the lung is what we call inflammation. And that's similar to saying if I took some sandpaper and scraped it across your arm and then stopped, you would note that the skin would become red, it would become very full feeling. It might even weep or have some moisture. And if I did that every day, a couple times a day, eventually that skin would actually scar. It wouldn't be normal skin anymore. The lungs are just tissue the way the skin is tissue. And so if you cause a continued and ongoing damage to it, even if it's a few times a day, but a few times a day perhaps over months or years, the tissue can't regenerate and can't heal. It's very similar to any other organ in the body. People don't see the lung, so they don't necessarily know it until there's a problem. But the damage, again, whether it's a vapor, a gas and chemicals, or smoke, a gas plus particulate matter, the lungs still just view that as something that's causing damage.
We know cigarette smoking can cause lung cancer. Do we have enough evidence that vaping can cause lung cancer?
It's a more difficult question because these are newer products. The fact of the matter is, in all likelihood, for what we've seen thus far, the answer is certainly probably yes. But if you take a step back from, say, even something as scary as lung cancer, smoking and vaping certainly cause significant damage to the lung and disease that is apart from cancers, what we call COPD or emphysema. It can exacerbate asthma. It can cause certainly chronic cough. It can make you more susceptible to having more severe respiratory illnesses. And so while I think it would be difficult to say this early on, because something like a cancer takes years to occur after, yes, there's no significant difference to the damage that is caused by vaping than we know is caused by smoking. So we would have to certainly presume that, yes, cancer is up there. But we do know that the other diseases that occur, COPD, emphysema, worsening of asthma, development of asthma, as well as just overall worse outcomes from any given respiratory illness, infection, et cetera, absolutely do occur. So it's I would say it's a much broader picture than even just cancer.
You mentioned in your answer where some people try to rationalize it's not the nicotine, it's the tar and the other substances that really cause the damage. And you certainly pointed out how addictive nicotine is. But if we look at adolescence, isn't brain development impacted by nicotine?
It is. And that's, again, very well known and very well described over decades at this point. Brain development begins in utero, and really the first 9 months, the baby's brain is really still forming, but the brain is actually still developing until about age 25, and in very significant ways. And so nicotine, which is a potent neurotransmitter, or at least it binds to an area in the brain that way, is extremely not just addictive, but has direct effects on the body at the central nervous system in the brain. Smokers know this. Smokers learn this naturally. Anyone who has ever smoked will tell you that when they're nervous, they smoke slow and they take slow draws. When they're happy and about to do something fun, they may take a few quick puffs. And what they've learned naturally is that if they get high levels of nicotine quickly, it actually stimulates them. If they get lower levels of nicotine slowly over time, it actually helps to calm them down. These are potent chemicals that have absolute effects in the brain and on the developing brain. And again, one of those topics that I think I certainly never understood before I was a doctor was the fact that again, the brain itself really is developing in some ways up to and beyond even about age 25.
These have been the excellent comments of Dr. Andrew Miller, a pulmonologist at Texas Health Harris Methodist Hospital in Fort Worth, a topic we probably have not talked about enough. Now, we're going to keep the theme of our kids going, but we're going to have one of the most information-packed segments about our teeth that all of us can benefit from next on the human side of healthcare.
Welcome back to the human side of healthcare, where we explore how to take better care of your health so you can live a happier, healthier life. with DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome to the Human Side of Healthcare. Delighted you're with us today. Today we're going to talk about something so important in your overall health. We're going to talk about good dental care. And we're delighted we've got with us Dr. Tonya Fuqua, who is very active in many of the dental associations in Tarrant County, in the state of Texas, does great work in Fort Worth, and she serves the dental needs of low-income children in the community through Cook Children's not-for-profit dental program, Save a Smile. Dr. Fuqua, welcome to the show.
Thank you. Thank you for having me, and I really appreciate the opportunity to share the fact that oral health is a part of our overall health. So thank you for having me.
To set the stage for our listeners, I know it's important for them to understand this. Why is dental health so important to our overall health?
Well, I'm going to speak definitely on the behalf of kind of children, but really everything I'm going to mention really impacts all of us. For lack of better words, our mouth is the opening to the rest of our body, right? Oral health is an integral part of our overall health. Dental care, dental disease is one of the most preventable diseases that's out there, that's a part of our mankind, and it can be prevented by just simple toothbrushing, getting professional dental checkups and cleanings, controlling the amount of sugar that we intake by what we eat or drink. So it's just really important to be proactive with our dental care than reactive once something happens, right? Prevention is key. So I can say that that's definitely one thing to have as a key reminder out there for oral health. Such simple things, we can help our body to be as healthy as it can be. So starting early is key with children. It's really, really important.
What are your thoughts related to parents that say, I'm not going to care that much about baby teeth, but I'm really going to focus on the permanent teeth of my children?
Oh, my goodness. That is such a great question. And you're exactly right. We hear that all the time. We get asked all the time, aren't they just baby teeth? They're going to fall out, right? Well, baby teeth are the precursors to what's going to happen with that child's oral health. Baby teeth help babies to chew, to get their proper nutrition. It helps them to learn to speak and their speech development. If the baby teeth are lost too early, they may speak with a lisp because they don't have those front teeth for that tongue to touch to learn to pronunciate words correctly. It helps contribute to the facial form, to create our smile. It maintains, our baby teeth maintain space so the permanent teeth know where to come in and that they have guidance. The baby teeth actually guide the permanent teeth to know where to come in. And of course, if baby teeth are decayed or they have cavities and they're in pain, it impacts their ability to learn, to focus, to participate in activities or succeed in school or whatever they do in life. I don't know about you all, but if anyone's ever had a toothache or even just a headache, think about how that impacts how you feel overall. And think about that child who doesn't even realize they're in pain and it's created from a tooth that's hurting. They just know they don't feel good or feel right. So it is really important. That's a really great question.
You raised such an excellent point. When I talk to people, especially that focus in the social drivers of health or the social determinants of health, they say exactly what you said. If a child is at school and their teeth hurt, they're not going to learn. It's going to impact their education. So thank you for pointing that out. But when it does come to children, what are some of the other risks of poor dental health that poses to an otherwise healthy child?
That's another great question and point. Tooth decay, I'll have to say a couple little statistics to kind of put it in perspective. Tooth decay is the most common chronic childhood disease. That is not what people think about. They don't think that teeth are up there on the disease process in children. Tooth decay is actually 5 times more common than asthma, but everybody knows about asthma, or they at least understand it to a certain degree. And tooth decay is actually a bacterial infection. That's actually bacteria that decides to go out of control and get crazy and start eating away at the tooth structure. So a cavity is not just a cavity. It's bacteria in there eating away at your tooth. And if it's allowed to get out of control and the body's not handling it, then it becomes an abscess. And really the tooth is infected. So if we have cavities and we have all that bacteria in our mouth, that triggers and opens up our immune system, right? Where our body's trying to fight off that bacteria. Well, if our body's trying to fight off that bacteria, that basic, what people think is a basic cavity, then guess what? If they get a cold or they get something else basic, their immune system's already working in one area and they may not work as effectively to fight off that cold or that strep or that flu or that anything else they may get. So again, I can't express enough that it's really important to keep that type of bacteria that grows in our mouth every day. It's there every day in all of us, but we have to keep it in check and under control and not feed it with all that sugar. So that's a really good question on how that can really impact a child or anyone's overall health.
You mentioned something in your answer that I just want to repeat for our listeners, and that's the most chronic childhood disease is tooth decay. That is something most people probably just don't know. No, they don't. They really don't. And it's so preventable with basic tools and basic day-to-day hygiene and going for a checkup and cleaning twice a year. Prevention is key, like most anything else. And early detection is always better. What we as lay people may not understand, this can impact cardiovascular systems, even in our kids.
Very, very true. And things that are the bacteria that's floating around in our mouth can most definitely impact our medical health, what people think of as medically, like you just mentioned, their heart. What if they have, diabetes? They have some other medical condition that's requiring them to maybe take lots of medications. Even taking medications can impact what's happening in the mouth, because for kids especially, they usually take medications in a syrupy, a liquid format because they can't swallow pills maybe yet. And that can impact and just sit around in the mouth. Asthmatics tend to have, or patients with lots of allergies, their saliva content is different, which then impacts the oral cavity. But you definitely don't want the bacteria growing in the body that, again, doesn't just stay in the mouth. Every time we swallow, we're swallowing some of that bacteria, and it's floating around in the bloodstream. And if you have an area in your body that, like your heart, or have a cardiovascular issue, that bacteria is going to go straight to where that is. It's going to go where your body's most susceptible. So it is really crucial to make sure that, it can go both ways. What happens in the mouth can impact your overall health, but what happens with you medically can actually also impact your oral cavity and make things a problem. Like I mentioned, the medications, or you don't have the salivary flow that you need because medications are decreasing that or something. So they work so hand in hand, and we have to look at both.
I mentioned when I introduced you that you help serve the dental needs of low-income children through the program that Cook Children's has, Save a Smile. Can you explain to our listeners what the Save a Smile program is and how it impacts the lives of these low-income children?
Oh, I would love to. Thanks for asking about Save a Smile. This program was started in 2003 when Cook Children's just really said we need to get on board and do something about oral health, because too many children were ending up in the emergency department because of dental pain or swollen faces. So Save a Smile was created in 2003 to prevent that, kind of a grassroots, innovative type program where we go into the school system and actually provide dental screenings free of charge by a licensed dental provider, a dentist in our community that volunteers their time to screen these children and identify these children that have severe level of dental disease. And then we have a social service component that connects those children to private practicing dentists in the community that provide free dental care. We're going into Title I schools. So these are kids that are at risk already with all kinds of things. And dental becomes very low on the priority list. So with our social service component, with our master's level clinical social worker, we go in and find these children who need us and then connect them to a dental provider to provide comprehensive care, meaning anything and everything they need to get them healthy and happy and smiling again. And it's a huge collaborative effort within our community with our school districts, our dentists in our community, and Cook Children, saying this is vital to the health of the children in our community.
This is Tonya Fuqua. She is a dentist who also works with Cook Children's not-for-profit dental program called Save a Smile. A wealth of information. When we come back, we're going to tie your teeth and your heart together for good health. Stay with us on the human side of healthcare.
Covering the healthcare topics that matter most to North Texas. This is the human side of healthcare with DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome back. We're continuing our conversation with Dr. Tonya Fuqua, who is a dentist in Southlake and also works with Cook Children's in the Save a Smile program, serving the dental needs of low-income children in our community. She also has some great information for us adults as well. Steve?
You know, as you work with these children in this great program you're doing, let's say you found a child with a severe overbite. Do you actually help with orthodontic work?
Yes, sir, we do. And that is part of what I mean when we talk about comprehensive care, comprehensive in scope. So it doesn't matter if this child, whatever their needs are, I mean, God forbid, we have found, unfortunately, children who have had, lesions in their mouth and benign tumors. This is a vulnerable population. And as you know, any vulnerable population, they just have an increased risk of all kinds of healthcare needs, right? Dental is no different, and it's probably higher up there. And so if they have malformation, they can't speak right, super overcrowding, deep overbites, where it's really hampering their function, right? This is not just about the health, but the function, long-term stability of this child to function and have their teeth and their jaw and be able to smile and eat and talk appropriately. Not having the teeth in the right area can definitely cause a problem for speech impediments and stuff. So that is definitely something we look at, and we have all specialties involved with Save a Smile, from our general dentist, our pediatric dentist, oral surgeons, orthodontist, prosthodontist, endodontist. I mean, we've got them all on board, and they really treat these children like any other child that would come in their practice, in their private practice, and take care of any and all needs they have.
That is just tremendous. You're giving back so much to our community. Why are you so passionate about children's dental health?
Oh, my goodness. I wish I could really come up with the perfect definition. I don't know. I can't really say exactly why, but I will say a smile is such a powerful thing. It's about the impact that it has on their overall health, the impact their teeth and their smile have on their self-esteem, their confidence, how someone feels about their self, their mental health. No matter what age, you're impacted by that smile. That's what people see when they look at you. Your smile is part of your identity. So I feel like I'm doing so much more as a dentist than just fixing teeth, drilling and filling. I'm impacting someone's life. So I think that is what drives me and gets me excited. And what is more exciting than helping a child smile? I mean, you can't help not smile yourself when you're looking at a child and they're smiling or they're giggling and their eyes are lit up. I mean, there's nothing better than that. So I think in a nutshell, I guess that's what really drives me and gets me so passionate about oral health.
What a great answer. You really touched on it when you said you're truly impacting the lives of children. And we can't thank you enough. You've done a fantastic job. I'm going to stop because Thomas always has really good questions, and I'm sure he wants to ask you a few as well.
Yeah, I've got a couple I think that we could play with here. So let me ask you this. Diet and what happens in our mouth. Would you just go through kind of the major things that we all eat, kids do, and then tell us how they affect our teeth? So sugar and carbs, vegetables, and then the meat department, meat, fish, poultry, and fruit. How do all of those impact our dental health if we have a predominant diet of those?
Well, that's a really great question, Thomas. You know, people don't always, they first of all think about food and think of body, how it affects your body. Well, your teeth are part of your body, and everything we eat and drink does impact our body and our teeth. So one of the biggest things that we see that children are doing, sugar. It's not just candy. People think, well, that's the problem, but people forget about all that liquid sugar, juices, natural apple juice. People think, well, that's apples, that's a fruit. But apple juice and 100% sugar, or any fruit that has natural sugar in it, too much of it, that's natural sugar. So even like a diabetic has to be very careful with how many fruits they're eating and which kinds, because it can impact their sugar levels. And that's the same with teeth. Gatorades, Powerades, our sports drinks, the Monsters, the energy drinks, coffee. Children are now drinking, love the Starbucks and the coffee drinks, and all of those have a lot of sugar in them. We could see kids that I've seen them their whole life, and they've never had a cavity. They go off to college, and all of a sudden their diet changes completely. They're eating and drinking things that, you know, maybe mom or dad didn't let them do at home, or they didn't have access. Now they're needing energy drinks and they're needing caffeine, and they're drinking those things, and they're staying up later and then falling asleep and not brushing or cleaning. And then you mentioned carbohydrates. Carbohydrates break down to sugar. So we all love bread, and we don't maybe think, well, we think bread is maybe not that healthy, but it breaks down to sugar. Carbohydrates, crackers, and our goldfish that we give our kids, and pretzels, those things break down to sugars. And like I already mentioned, fruits and vegetables, always best selection. As far as putting in a good balance in our diet, fruits and vegetables are great for our teeth as well as our body. But getting protein and also getting that, like the milk and the calcium, that's also great for the building of the teeth, and the protein for the strength and the health. Protein even too for the gum tissues. You know, there's gum tissues and bone that support those teeth that are in your mouth, and the different good balanced meal that we always ask for our body, same thing to impact the health and the strength of our teeth and our enamel.
That's great. Bone. Great answer. Something that I came about, we're talking about kids here as well. When I was a teenager or maybe into my 20s, the dentist said that I'd been over brushing and has been eroding my gums. Can you tell us about that?
Yes. Wow. That is something that we see all the time. And it's really, you can call it overbrushing, or it's more appropriately known as you're not brushing correctly, right? So there is a right and wrong way to brush. And that's part of the big importance of going to a dentist early and starting the good habits and learning how to do things correctly. So brushing should be done in a circular motion. You should always be using a soft, bristled toothbrush with an appropriate size head. Everybody thinks that the bigger the head, the more surface area they're getting, but it needs to be appropriate for everybody's mouth because everyone's mouth size and teeth size are different. So some people may require a much smaller head so that it can get everywhere in the mouth. So appropriate size toothbrush, soft bristles, and circular motion at a 45-degree angle, meaning you don't want to scrub back and forth and you don't want to go up and down. Those motions over and over and over cause us to get what is known as receding gum line, meaning you literally brush the gums away. And our body is remarkable about healing itself, but that is one thing that it will not recreate. It will not produce new gum tissue that you've brushed away over time and over time. So brushing correctly will really prevent from damage to the gum tissues and then to the tooth, because then the root's exposed. And the root is not meant to be shown to the real world. It's supposed to be covered up with gum tissues. Yes. So it can become very sensitive to have the root exposed.
That's Dr. Tonya Fuqua, one of the partners at Fuqua Advanced Dental in Southlake, and also working with Cook Children's on this very important Save a Smile program. Steve, we're right up the middle on that one, aren't we? The human side of healthcare.
We sure are, Thomas. And we're going to continue the human side of healthcare as we move into 2023. We are going to run this show through March 31, 2023, and we look forward to some great segments over the next 3 months. Happy New Year, and join us next week for the human side of healthcare.